Updates regarding the situation along the border. Humanitarian needs has surged in Cambodia as border displacement impacts millions of Cambodian civilians in 2025. Conflict-related displacement along the Cambodia-Thailand border emerged as a major driver of humanitarian needs in 2025, affecting communities across at least 5 provinces, according to new figures released by World Vision International in Cambodia. The report highlights currently that provinces including Siem Reap, Banteay Mean Chey, Bat Nam Bong, Udon Mean Chey, and Prep Here were among the hardest hit as thousands of families were forced to flee their homes amid escalating tensions along the frontier. In response to the crisis, humanitarian and development programs reached approximately 5.4 million people across Cambodia in 2025. Aid agency expanded emergency operations to address the immediate needs of the displaced populations while continuing long-term support in key sectors such as education, healthcare, water access, and livelihood. Of those assisted, 3.1 million were children, reflecting the disproportionate impact of displacement on younger population. World Vision International described 2025 as one of the most challenging operational years in recent memories, citing the overlap between conflict-driven displacement and existing rural vulnerabilities. More than 140,000 internally displaced persons were supported, including over 43,000 children and 1,100 individuals with disabilities. Assistance ranged from food distributions and clean water provisions to sanitation facilities, temporary shelters, and cash aid. Specialized nutrition programs were also delivered to pregnant and breastfeeding women. To support children affected by displacement, humanitarian actors established over 45 child-friendly spaces and 54 temporary learning centers across impacted areas, helping restore a sense of stability and continuity in education. Speaking during a school inauguration in Pravihia, Minister of Education, Youth and Sport Hong Chunarun praised the organization's 56-year presence in Cambodia, noting its consistent support for communities affected by conflict since the 1970s. Despite rising emergency demands, development programs continue nationwide. In 2025, over 164,900 children accessed inclusive education initiative, including nearly 19,400 who returned to the school after previously dropping out. Health and nutrition intervention reached more than 41,800 children under 5, while 28,100 children were screened for malnutrition as part of early detection efforts. Child protection programs expanded significantly, supporting over 184,200 vulnerable children through community-based systems. Significant gains were also reported in water, sanitation, and hygiene, initiatives with 451 communities declared open defecation-free, a milestone seen as critical to improving public health and living standards in rural Cambodia. Minister of Rural Development Chai San previously highlighted collaboration with development partners as essential to achieving national sanitation targets under Cambodia long-term action plans. Economic empowerment programs also contributed to resilient building efforts, with more than 2,400 households receiving financial literacy training and 2,300 women supported in income-generating activities. At local governance level, 976 communities and districts allocated a combined $808,645 from their budgets to strengthen social accountability and improve public service delivery. As displacement pressures persist along the border region, humanitarian actors face increasingly difficulty balancing urgent crisis response with sustained development efforts. Experts warn that vulnerability in Cambodia remains closely tied to geography, poverty, and recurring shocks, factors that could continue to test both nation system and international partnerships.